Hi everyone, Hope Merz here. I'm a nurse practitioner with Dr. Mendelson at Advanced Cosmetic Surgery and Laser Center. And today I'm really excited because I'm getting some fun procedures done. So I'm going to get submental, which means this area, liposuction, because I just do not like this on myself. And some people are bothered by some things and some people aren't. And this just, it bothers me in every photo I take. And even Easter photos, I got them back and I was like, yep, I'm glad I'm on the schedule, we're doing this. So what we'll do today is a little local numbing, lidocaine with epinephrine, and then liposuction in this region. Then Dr. Mendelson will see what skin is excess here and remove that, and then put a suture line right here. So I'm so excited. And of course I'm gonna have Dr. Mendelson do it because he's the best. And I've seen him do these a lot of times and they look awesome. And so I am very excited for that. And then also I'm gonna do a dot laser treatment. So I've had lasers in the past, I've had fractionated lasers. I really try to stay up to date with my skincare. Whoever knows me knows that I'm very passionate about skincare and especially preventative and maintenance skincare because it's very important. Skin ages quickly. So I've been seeing patients the last couple weeks telling them that I'm getting this done, and they go, a lot of them have said, well, why are you doing this? I don't see, wrinkles on you. Why are you going through this procedure? And I was surprised to hear that from a lot of different patients, but really my answer is because I want to keep my skin looking healthy. I want to prevent wrinkles as much as I can. And by doing things like lasers and microneedles and different maintenance treatments throughout the years, it really does help do that. But the main thing I'm noticing right now is my familial genetic under eye. So when I'm smiling, even though I have filler under here, I get Botox, I have this bunching of skin. So I really want to help tighten that up. And then I'm just going to do kind of a light facial treatment while I'm doing it. So I'll do some photos and things like that during the healing process so we can all see what that's like. But here we go. Here's my first update. I am about, 2.5 hours out from the laser treatment. Prior to that, I had my liposuction of my submental area and skin excision. And right now, I am feeling pretty good. Immediately after the laser, it was hot. I would say, Dr. Mendelson asked me and I said it was about a 7 out of 10. On the grand scheme of things, it probably wasn't really that painful, but it was hot, like a sunburn, accumulating heat after the laser. And then within about 20 minutes of the icing, I would say that was, so much more tolerable. I think I said a level 3 out of 10 pain-wise. And now, 2.5 hours later, really, the skin does not have any pain. I feel maybe a little bit of heat. I'm starting to get a touch tender under here, which, of course, the lidocaine is, I'm sure, starting to wear off. So that might be a little bit more sore throughout the night tonight. But I'm just going to try to stay elevated and keep the swelling to a minimum. You can see I'm not opening my mouth that much because I don't want to stretch on anything, but so far so good. I will keep you updated. You can see maybe up close, a little bit of oozing and bleeding starting to happen where we went a touch stronger in the upper lip and underneath the eyes. So I'm excited. We'll keep you posted. Morning. This is day 1 after my procedure. I wanted to take a video before I wash my face so that you can see the normal drainage of what we call a fibrinous exudate on my skin.
This yellow stuff is not pus, it's not infection. It is normal healing elements within our skin kind of oozing through the surface. And I'm gonna gently wash off what I can, but I don't wanna scrub any of that off because it is healthy and healing. Mainly that's gonna happen in the areas where we use kind of a deeper setting, a more aggressive setting, like in the under eye area and around the mouth. But anyway, now I'm looking forward to washing my face. Okay, checking back in, just washed my face. See how I didn't scrub too hard at that fibrinous exudate I was talking about? I just gently got off what I could. There's still even a little aquaphor remaining, which is fine. We want that to be our occlusive barrier to protect your skin against outside pathogens like any kind of fragrances people are wearing or pollution or anything accidentally touching your skin. So I'm going to reapply my aquaphor and I'll check back in later. I did pink up a little bit. It was just a touch stingy to wash my face this morning, but now that has completely calmed down. I'm gonna reapply my aquaphor and be good to go for the day, so. Okay, just checking back in. It is the end of the day, day one, post-op, and I've got my chin strap on, which kind of enhances my swelling that I have a little bit in my cheeks, but overall, doing pretty good. You can see this little bit of the fibrinous exudate we were talking about earlier is coming back throughout the day today, so I'm gonna wash my face again soon. You can start to see the little grids of the dot laser showing up as the inflammation in between them is reducing. So starting to heal up, yay. Hopefully tomorrow I will be even less red and less swollen. I do have rosacea, so I would plan for me to hold redness maybe longer than the next person. But anyway, going to wash my face. My chin feels good. It was a little bit more tender throughout the day today. You can tell I'm talking a little bit better. It still feels just tight, so I'm trying to be real careful with it. And going to work tomorrow in the morning, so we'll have another update soon. All right. Okay, hi everyone. Day 2 of recovery from my dot laser on my full face and submental liposuction with skin excision. So underneath here, I'm still swollen, but it's gotten better. I would expect that to really probably start improving visibly day 3 would be my guess, but you can see more of those grids showing up on my skin. You can see under my eyes, the re-epithelialization, the new skin forming, the old skin shedding. That's the only part that's still tender on my face, is right here. So when I wash, it's still stingy right there and it feels good to put the aquaphor back on. But other than that, everything feels fine. My chin is a little bit sore, but better than last night. My swelling got worse throughout the day yesterday. I was doing more activity probably than I should, but now after elevating throughout the night, it looks a lot better. It has been itchy off and on, and I would recommend having a Q-tip handy because I've been using it just to itch here and there instead of, you know, using your fingernail. As it heals, that's a common occurrence and totally normal, but hopefully today less drainage because that oopy goopy part was pretty gross. I washed my hair last night and it was probably a futile attempt because you can see it's still already getting that aquaphor back in it, but anyway, doing well. I'll check back in later today. All right, here I am, end of day 2, post procedure. I had both of my procedures Wednesday afternoon and it is now Friday evening. You can see that the dot is slowly starting to heal on my face. less inflammation, less redness, less oozing for sure, which is great. It feels so much better once that oozing stops. You can see a little bit of purging in my pores here or there. It's not really true acne, it's just the skin healing, and that will come out on its own, so you don't need to pick at that, you just leave it be. And as you cleanse throughout the days, that will come off. My submental lipo, still a little bit swollen, but feeling much better, much less sore today. Really not sore in the least unless I'm touching it and reapplying my chin strap. So doing good. I'll check back in tomorrow. Just wanted to check in and show how I'm wearing my wide brimmed sun hat because I'm just outside for a little bit of time so my daughter can run around and get some energy out, and I'm hiding in the shade. So this is appropriate sun attire after a laser. You don't want to be out too long. I would say keep it less than 1 hour and wear a wide brimmed hat and stay in the shade. All right, I'll check in again later with a clean face and show you what my skin looks like. Day 3 update for my CO2 laser on my full face and submental liposuction with skin excision. You can start to see a little bit more of a defined jawline, which I am very excited about. I know there's still swelling there, so that has a way to go healing wise. My face is doing well. The drainage has stopped and you can see this fine scale, almost like a little bit of peeling, which I'm trying not to pick at, but it's hard, but I'm not going to because I want it to heal correctly. The little bit of purging that I had on my chin and my nose has nearly resolved on its own. And my under eyes are a little bit redder right now because I just got out of the shower and I accidentally let the shower head hit me in the face and it burned a little bit. So try to avoid that. But I'll put some Aquaphor on here in a minute and that should calm down. So overall, doing great, super excited, and I'll keep you updated. Okay, day 4 update, and I'm still doing very well. I don't think much has changed with this submental lipo and skin excision. Still swollen, but obviously to be expected at this point. And then what I have noticed today is a lot less redness on my face. Mainly my forehead looks like it's almost just to a barely pink tone. And my cheeks are seeming to heal from the outside in, which we do kind of commonly see with this laser post-care. My under eyes are still red, and since I just washed my face, that's probably a little emphasized right now, but that's to be expected. That does take a while to slowly fade out to a pink color. I'm day 4 right now, so about day 8 to 10, depending on how I heal, I should be able to put on some under eye concealer, and that can cover that up pretty well. But over the next few months even, that will wax and wane with a pink tone, like if I get hot or if I'm out in the sun a little bit, and that's normal. So we do expect that to happen here or there. But everything's doing well. I had more shedding than I thought I would yesterday. It seems to have slowed down a little bit, but throughout the night and this morning, I had a good amount of extra skin on there. You can still see a little bit shedding off to the side, but I just washed my face, so I probably took a good amount of that off. So I was itching here or there with my Q-tip, and that did help relieve a lot of the itching without risk of contaminating my skin. So doing good. I'll check back in tomorrow. Hi everyone, day 5 update from my CO2 laser on my full face and submental liposuction with skin excision underneath my chin. So you can start to see the improvement there, which is awesome because I've always been so self-conscious of that. And my face is definitely less pink today. I am breaking out just a little bit in acne here or there from the Aquaphor, and that's okay. That'll go away in a day or 2 on its own. I'm not typically acne prone, so I'm not worried about it. If you are acne prone, I can always write you for a longer antibiotic prescription that can help prevent those breakouts a little bit better. But anyways, doing good, and I will check in again tomorrow. All right, have a good day. It's time for my day 6 post-op check-in from my CO2 laser on my face and submental liposuction with skin excision, which is all still healing well. The tape is starting to come off my incision line a little bit, you can see, but that's okay. That's kind of common at this point, and I can just gently trim back the tape that's kind of coming off, but you don't want to pull on that tape because you don't want to risk pulling at your incision line. So this still is a little swollen, touch tender if I push on it, but other than that, I don't even notice it really. My face is breaking out less. This is my last day of Aquaphor. Yay. It gets in my hair and just kind of everywhere and feels a little bit goopy. So now I'm able to switch in the morning to a moisturizer instead of Aquaphor. So the difference is Aquaphor provides an occlusive barrier over the skin, so it keeps other things outside instead of getting in, like, you know, different fragrances and other chemicals, pollution, anything that can irritate the skin, it provides a barrier. The other reason that we do that is it keeps your own skin's moisture inside instead of losing it via epidermal water loss. So your skin hydrates itself, but at 1 week out, you tend to crave moisture, your skin does. So we switch you to either CeraVe cream, which is a little bit lighter feeling, or Eucerin cream that feels a touch heavier. And I think I'm gonna start with the Eucerin cream tomorrow because I tend to run more dry, and whenever I wash my face before I put Aquaphor on, it feels pretty tight. So I think I need the moisture. And so that's the one I think I'm gonna go for tomorrow, but all good. Breakouts have slowed down, less pink, feeling more even skin tone and tighter, so good. And I will check it back in tomorrow. Day 7 update. I was able to put moisturizer on this morning, and I really think that my skin was craving that. It has gotten a lot less pink tone today, and it feels better. It feels less tight, like not in a good way tight. It was just feeling like it needed some hydration. So I'm seeing a great difference already. My pores are smaller, my fine lines are smaller, my under eyes are tighter. Everything is just so much improved in regards to texture. And I'm putting Aquaphor underneath my eyes still. You can still see that there. My under eyes just felt a little itchy, a little scaly still today, so I'm giving that another day or two. And then my liposuction is healing up well. It still feels a little bit dense here, a little swollen, so that has a ways to go, but I get my sutures out tomorrow. So I think I might start updating every couple days now because I don't think too much will change day to day, but if it does, I'll let you know. And stay tuned. Day 10 update. We are hanging out outside, so you can see I've got my wide brimmed hat. You definitely want a wide brimmed hat after any kind of skin procedure because it covers the sides as well as the top and front of the face, as opposed to a baseball hat that does not get the sides of your face, so you want a wide brimmed. I also have on Physical Block SPF over top of my Eucerin cream. And Physical Block means that the active ingredients are zinc and titanium in your sunblock. And that just makes the UV radiation literally bounce off your skin, as opposed to creating a chemical reaction within the skin. Those are more your sunscreens like the octinoxate, avobenzone, those kind of longer word ingredients that you see on the back. So definitely better after a procedure. You want to use a mineral sunblock. And everything's going good. My texture is feeling great. My under eyes are definitely tighter. My pores are smaller, everything. It's just awesome. But I did pink up a little bit yesterday. I was at a outside birthday party that I didn't know was going to be outside that much, and it was very sunny. So got a little pinker than I would have liked to. But other than that, all good. And I'll update you again in a few days.